This is the vital signs section. We will first start with blood pressure. Please read in your clinic manual for the exact written protocol. You will notice for this demonstration, the clinician does have a mask on because we are following social distancing rules and regulations. This may change in the future. The point of this video is for the actual steps of how to take the vital signs.
First, you will determine and document every patient's blood pressure at each appointment, and you will explain the procedure to the patient and rationale.
Hi, Ms. Mitchell. I'm going to be taking your vitals today. We're going to do blood pressure, and then we're going to check your pulse and respirations, and then we're going to take your temperature. Okay. I'll probably be marking them down off on a Post-it off to the side, so just so that I can average them later. Okay?
Okay. You will select the appropriate site for measuring blood pressure based on the patient's medical history. Avoid site arms with presence of shunts, ports, grafts, fistulas, single or double mastectomies, etc. If the patient is unable to have a blood pressure reading taken in either arm with an arm cuff, the wrist cuff may be utilized. Refer to the information below. You will prepare the patient. Chair in upright position, legs uncrossed. Ask patient to uncross legs if necessary. Forearms supported at heart level and unrestricted by clothing. Arms slightly flexed, palm up.
All right, Ms. Mitchell, I'm going to have to make sure your legs are uncrossed. Awesome. Do you mind pulling up your sleeve for me? Show me the muscles. Woohoo! All right, I'm going to let you relax your arm down and have you do palm up for me.
You will select the appropriate arm cuff size. Width of the bladder should be less than half the circumference of the arm, and the length of the bladder should be at least 80% of the arm circumference. Larger and smaller cuff sizes are located in the dispensary. Place the deflated cuff correctly around the patient's arm. Place firmly around bare upper arm with the lower edge 1 inch above the antecubical space. Bladder must be centered over brachial artery. Cuff should be wrapped and secured snugly. Will not dislodge when tugged lightly. Adjust the gauge for easy viewing. Place the stethoscope earpieces in ears with tips directed forward and indicator dot on base of stethoscope turned toward the diaphragm end piece. First, you will determine the maximum inflation level. Now I will say MIL for further reference. First, locate and palpate the radial pulse. Second, close the valve and pump to inflate the cuff until the radial pulse is no longer palpable, mentally noting the reading.
Okay.
Third, you will inflate the cuff 20 to 30 mmHg beyond where the radial pulse was no longer palpable. This is the MIL. Mentally note the MIL.
140.
Quickly place stethoscope end piece over brachial artery after determination of MIL for reading. Place end piece slightly toward the inner side of the arm just below the cuff without touching the cuff or tubing. Hold end piece lightly in place for reading using fingers and no thumbs. Deflate cuff gradually and steadily after inflating to MIL to determine reading by opening valve. Deflate 2 to 3 mmHg per second.
Okay.
Mentally note the first audible sound. This is the systolic blood pressure. Mentally note the last audible sound. This is the diastolic blood pressure. Complete deflating cuff by completely opening valve. Rapid release after diastolic pressure is obtained. You will write down systolic and diastolic pressure on a sticky note for first reading.
62 over 120.
Then you will wait 30 seconds for second reading. Use the same arm for the second reading and repeat steps 9 through 15. The MIL does not need to be determined again. Cuff can be inflated to MIL to begin obtaining second reading. Write down the systolic and diastolic pressure on a sticky note for the second reading, and then average first and second reading for final systolic and diastolic blood pressures. Document final blood pressure reading as a fraction, example 120 over 80, and include which arm was utilized. Example, right arm sitting would be RAS. Then you would wipe your earpieces with the alcohol-saturated 2x2. Call to the prompt attention to the assigned instructor any variation from normal or from previous blood pressure readings documented in the patient's record.
I'm going to have him inflate the cuff a little bit and deflate so that I can zoom in on you seeing how slow the needle will be moving on the...
So I'm going to go back up to the 140 because that's my maximum inflation level. And then I'm going to slowly start to release. There.
And then once you hear the last audible sign, then you can do your quick or fast release. This concludes the blood pressure. We will now move to pulse and respiration.
What was it?
120/63.
Oh.
Yeah. You taking your meds?
Oh.
This is the pulse procedure. Determine and document every patient's pulse at each appointment. Explain the procedure to the patient and rationale, which he did prior. Prepare patient. Chair in upright position, arm and hand supported with palm down.
All right, Ms. Mitchell, I'm going to have you point your palm down for me, and I'm going to hold on to your wrist, okay?
Locate the radial pulse on the thumb side of the wrist. The tips of the first 3 fingers, index, middle, and ring fingers, should be utilized. The thumb should never be utilized. When the pulse is felt, exert light pressure with the first 3 fingers and count number of times the heartbeat is felt for 1 clocked minute. A clock with a second function must be utilized for the 1 clocked minute. If necessary, repeat the steps 4 to 5 above. While taking the pulse, observe the following for any variation from normal: the rhythm, volume, and the strength. Document pulse rate and any variation from normal in rhythm, volume, and/or strength. Call to prompt attention to assigned instructor any variation from normal or previous pulse rates documented in the patient's record.
We're not going to do the full minute. We're going to move into respirations. You will not let the patient know you are checking respiration.
You will determine and document every patient's pulse at each appointment. You will explain the procedure to the patient and rationale prior to doing. Prepare the patient, chair in the upright position still. Make sure the count of the respirations immediately after assessing the pulse and maintain the light pressure with the first 3 fingers on the radial pulse. This is because respirations must be assessed so that the patient is not aware, as the rate may be consciously altered by the patient. Count the number of times the chest rises in 1 clocked minute. It is not necessary to count both inspirations and expirations. A clock with a second function must be utilized for the 1 clocked minute. While taking the respirations, observe the following for any variation from normal: depth, rhythm, quality, sounds, and position of patient. Document respiration rate and any variation from normal in depth, rhythm, quality, sounds, and/or positioning of patient. Call to the prompt attention to assigned instructor any variation from normal or from previous pulse rates documented in the patient's record.
So what I'm doing is I'm keeping my hand here. So I've already taken the pulse. I've done the 1 full clock minute, but I stay here and I'm watching her breathing. I'm watching her chest rise and fall. She takes full breaths. Her chest goes up, it comes down. It's not ragged, it's not jittery, it's not fast. So that's what I'm looking for. But I'm not going, I'm going to check your respirations. Make sure that you're just kind of staying calm. You can side eye, you can count them that way.
So you may want to tell the patient when you're doing pulse that you're going to be like this for about 2 minutes, because we know 1 minute is pulse and the other will be respiration. We will now move on to temperature.
For temperature, you would determine and document every patient's temperature at each appointment. You will explain the procedure to the patient rationale, which he did prior. You will prepare the patient, chair in the upright position. You will obtain oral temperature. Note, wait at least 15 minutes before taking temperature when patient has been exposed to cold weather or has been engaged in eating, drinking, or smoking. Peel back top of wrapper to expose thermometer handle and remove by pulling. Place thermometer in patient's mouth under the tongue as far back as possible into either heat pocket by posterior teeth under tongue, just as any other oral thermometer would be placed.
All Alright, Miss Mitchell, I'm gonna have you open your mouth. I'm gonna go way, way in the back, as far back as I can. I'll have you close.
Patient press down, tongue down on the thermometer while keeping mouth closed. Leave for a minimum of 1 clocked minute. A clock with a second function must be utilized for the 1 clocked minute. Shorter times may give inaccurate readings. Longer times will not affect accuracy. Have patient remove the thermometer from his or her mouth and place on bracket tray after 1 minute. Without touching thermometer, read immediately. The highest black dot indicates the correct temperature. When you are then gloved, you will dispose the thermometer in the unit trash and you will document the patient's temperature. Call to prompt attention to assigned instructor any variation from normal or from previous temperature documented in patient's record.
So once we finish our 1 clocked minutes, I'm gonna not touch it. I am not grabbing it. I'm gonna bring the tray close. Miss Mitchell, do you mind taking that temperature out and placing it on top of the tray for me? Oh, we flipped it. Excellent. So you can see the green dots. And then I'm going to take the reading from that tray. I'm not touching the thermometer at all.
This concludes vital signs.